Welcome on Speak Your Mind. I'm your host, Shamilo Lal, and my guest on Speak Your Mind is Dr. Aalisha Sahukhan. You've recently heard on our news and on our radio station news as well that meningococcal, doctor, that disease has been on rise, and it has been, the short form of that name has been now given Mensi, so pronunciation is a bit easier.
Yes.
Welcome on the Talkback Show, doctor. Tell me about this disease. What is this? Is it related to meningitis?
Thank you for having me on this show, first of all. Meningococcal disease was a relatively rare disease in Fiji. It's only in the recent months that we have actually, last week we declared an outbreak of meningococcal disease because we noticed a big increase in the previous year and this year as well. Meningococcal C is caused by bacteria called Neisseria meningitidis, and what it does is that if it gets into your blood, it can cause two major syndromes, and sometimes a combination of both. One is meningitis, which you just mentioned, so that's infection of the lining of the brain. Right. Meningitis can be caused by other things as well, viruses, certain fungi, parasites, but this meningitis is caused by meningococcal. The other syndrome that can cause is what we call meningococcemia. It's septicemia, which literally means the infection of the blood. So it's these two syndromes that meningococcal disease causes: meningitis and septicemia.
So the name of this disease, just for trying to learn to, as meningococcal is a disease separate from meningitis, right?
Meningitis is the syndrome.
Right.
So, for example, I think how would you say, it's caused by bacteria, caused by viruses. Okay. So meningitis is caused by different things. Meningococcal is one of the bacteria that can cause meningitis.
Okay. So this disease is the meningococcal as we speak, right?
Yes.
What causes this disease?
Okay, so as I mentioned, it's a bacteria. It's called Neisseria meningitidis, and there are certain forms of that bacteria that are really harmful to humans. Most people will carry this about 10 to 20% of people will carry this bacteria at the back of their nose or the back of their mouth at any given point in time, but they'll be fine. It just likes to live there. It's nice and moist and dark, and that's where it likes to basically reproduce. But they'll be fine. They'll have no symptoms. They'll never get meningococcal disease. A very small percentage of those people, less than 1%, will actually develop the disease because the bacteria somehow makes its way into their bloodstream.
Okay. And we're going to talk about the risks and how does it spread, etc. But as we speak, how many confirmed cases do we have in Fiji?
So as of last week, we have 38 cases. And out of those, 23 are confirmed. This is from January 1st this year up until March 29th. I'm sorry, there's 37 cases altogether. And of these, 20 are laboratory confirmed.
Is there any suspected cases apart from confirmed cases or probable cases?
Yes, so as I mentioned, so we're counting 37 cases total. Of those, 20 are lab confirmed. The remaining 17 are suspected based on signs and symptoms and diagnosis by their doctor.
We've heard a lot of cases, and it seems that the number is increasing. Is that right?
That's right. So as I mentioned before, meningococcal disease used to be quite rare in Fiji. We'd have a maximum of 10 cases a year. Usually it was 5 and less cases every year. Towards the end of 2016, in the last quarter, and then for 2017, and then up till now, we have noticed a dramatic increase in cases.
So did we at any stage anticipate its widespread in Fiji at a particular time like this when dengue fever is at rise, or it just happens at any time of the year or month or season?
Well, because it was such a rare disease, it did not have much of a season. If you're only having about 5 cases a year, you're not going to have much of a season. So this is very new to us, this increase in cases, and so it's not related to dengue fever. It's a completely different disease. Its spread is completely different. But yes, well, once we saw that this increase is not just caused by small pockets of cases, that's when we decided to call the outbreak and tell the public about what they need to know to prevent themselves from getting this disease.
So the number has increased from last year, and every year the number has been increasing.
So towards the end of 2016 is when it started really going up. So, and last year, that's when we had 48 cases.
Should we be very concerned about this disease, meningococcal or MENSI as in short form?
It is still a rare disease in Fiji. Even though we're having an outbreak now, we have about 2 cases a week. And if you compare that to something like dengue fever, where when we have an outbreak of dengue fever, we can have about 200 cases a week. The reason that we are coming out very strongly and letting the public know about this disease is because it has a very high fatality rate. So for the rare cases who do get it, the fatality rate is very high. I'd like to use dengue as an example because everybody is used to dengue, right? So we have quite frequent outbreaks of dengue fever. However, even during outbreaks, our case fatality rate, so the amount of people, out of all the people who have dengue fever, the amount of people who die is about 0.4 to 0.6%. And if you compare that to meningococcal disease, where the WHO says if you don't get treatment, up to 50% will die. If you do get treatment, even in developed countries, you still have between 8 or 6% to 15% of dying.
So survival rate is very...
No, survival rate is still very good. If you get treated, that's the thing. That's what we're trying to emphasize. You know, you still have like a 90% or 80% chance of survival. But because it has such a high fatality rate compared to other diseases, that is why we emphasize how important it is, and that it's a public health emergency and a medical emergency. So we really want the public to pay attention and learn about how to prevent it and how to spot it early.
So how does this disease spread?
Okay, so meningococcal disease, as I mentioned, is a bacteria. This bacteria is found at the back of your mouth or your nose, and it's in about 10 to 20% of people at any one time. So the way it spreads is that you need to actually get in contact with the saliva or spit of someone who's carrying the bacteria. And usually that saliva or spit needs to be somewhere on your face, get onto your mouth. So activities that involve your mouth touching someone else's mouth, so kissing on the mouth, deep kissing, that's one of the main ways that it is spread. The other activity that puts you at higher risk is sharing glasses or cups or bottles. In Fiji, we are very communal culture, and we share a lot more than I think other, and probably in developed countries. So we're used to sharing things. For example,
around the grog,
around the grog bowl, you share a bilo.
Yes.
If you go to a nightclub, you see people, tucking from one jug of alcohol using one glass, and you see the saliva is exchanged in that process. So anything that exchanges saliva puts you at risk of getting the bacteria.
Doctor, we will talk more about this. We'll break it down to other things which may be a contributing factor soon after this break. And you're most welcome to call us on Speak Your Mind and ask Doctor questions in relation to meningococcal, which is now a short form is MENSI, easier for anyone to pronounce. Welcome back on Speak Your Mind. Dr. Aalisha Sahukhan is my guest when we are talking about MENSI or meningococcal disease. Doctor, you said that anything that is to do with saliva. How about people spitting around? Do you think this could be a carrier of this disease as well?
Yes. So anything involved with saliva or spit, so people's actually spitting on the ground, that sort of activity puts other people at risk. Also, in terms of cough and sneezing hygiene. So you've noticed we really do emphasize as well that when you need to cough, when you need to sneeze, please make sure that you have a tissue or a handkerchief. And when you use that tissue, for example, you throw it away in a bin. Okay. If you don't have a tissue or handkerchief on you, try not to cough into your hands, because cough into your hands, you contaminate your hands, and then you'll touch someone else, and then it spreads. So if you don't have a tissue, you don't have a handkerchief, you can cough into your elbow, just bend your elbow and then cough there, or on your sleeve.
You can just say that's how risky it is if you cough and if someone has it. That's how easily it is spread.
It's less risky than things like kissing on the mouth, sharing glasses, for example. But if you cough on somebody, for example, and you cough in their face, near their mouth, then it has to get quite close. But that's why we're telling the public about these measures, these measures to prevent getting the bacteria. And really, cough hygiene, sneezing hygiene it'll prevent other diseases as well, besides meningococcal disease. And it's just a very good hygiene practice to have.
I think we have to form these good habits because it does irritate if you're sitting and cough, if someone is sitting and coughing or sneezing and then you have someone, in front of you. So it makes the environment a bit uncomfortable. And I've seen people, so I think it's time to take heed of these things. It's good to form good habits.
Yes.
How about people who exchange cigarettes?
Yes, so cigarettes is another one because, again, it's an activity that involves your mouth somehow getting in contact with someone else's mouth. So you share a cigarette, it's going into your mouth, and then it's going to someone else's mouth. So yes, definitely sharing a cigarette would also be a risk. I'd like to emphasize also that, with cough and sneeze hygiene, you need to be washing your hands. Frequent washing of your hands with soap and water is very important, not just for preventing meningococcal disease, but so many other diseases.
So which means now that I'm thinking aloud, using lipstick, makeups and other things which is on lips, that could be another risk factor, right? For ladies especially.
Now we're more getting into more smaller sort of areas. So we try to emphasize the very common activities that people in Fiji in particular are involved in. So sharing of cups and glasses and bottles and bilos and taki glasses, all of these things, and cough hygiene, sneezing hygiene, they're very important for preventing the spread of this disease, which is still quite rare. But it's a very it's a deadly disease.
Yes. So who is at risk of getting mense? Is there any age limit in children and in adults?
Okay. So anybody can get meningococcal disease. However, what we've seen for this outbreak in Fiji this year, the vast majority of cases, about 90% of cases, are in children, so people under the age of 19 years old. There are reasons for that. In particular, the under 5 age group is quite at high risk, as well as teenagers. The under 5 age group is because it's very easy for them to transmit disease. If you see little children, they always tend to be sick. The under 5s are always putting things into their mouths, touching their mouths. So there is a high chance that they can get the bacteria. Also, very young babies, their immune system is not as strong as adults, so they're more likely to get the disease and get sick. For teenagers and young adults up to the age of 24, they're more likely to take part in activities that put them more at risk. So sexual behaviors, kissing on the mouth, going to nightclubs and sharing glasses, or even on the sports field. You see people playing rugby, they may be sharing the same water bottle, for example. So all of these behaviors put them at higher risk, but anybody can get the disease.
So how can one know that they have got this disease? What are some clinical features or symptoms?
So in Fiji, right now, the most common symptoms, and this is in adults, babies and children are a bit of a special case, so just in adults, headache, nausea and vomiting, and a high fever. Those are the most common symptoms we've seen in Fiji. You also may have stiffness in the neck, a general feeling of tiredness and being unwell, body pain, diarrhea. So again, these are symptoms that are not very specific to meningococcal
because it
disease.
could be symptoms which could be of some like a normal fever or a viral infection, right?
Yes, and also we have a dengue fever outbreak going on in Central Division, so it can be similar to dengue fever. But what we're trying to emphasize to everybody is that if you get sick, if you have a fever, if you have a headache, you have body ache, please go and see your medical provider. They let them assess you and diagnose you. Don't try and think at home that, oh, I've got this, maybe I should go. Just go and see your medical provider.
Should anyone watch out for any rashes and wait till then, or should see the doctor immediately?
So the rash typically comes up in this other syndrome I talked about, which is the septicemia. and it doesn't always come up.
Okay.
So that's why we don't emphasize the rash as much. And also, by the time the rash comes out, you may be quite advanced in the disease. So we're not saying to people to wait to look for a rash. We're saying to people, if you have fever, you have a headache, you feel like throwing up, you're vomiting, please do see your health provider.
And as soon as possible.
As soon as possible.
Yeah.
And this is, as I emphasize, this is for adults and older children who will may have these symptoms. In young babies, it's very difficult. It's even more difficult to tell because babies can't tell you that their head hurts or their neck is sore. You know, the way that they show you that something is wrong is generally due to their behavior. They're crying more than normal, more not eating, or even they're floppy and they're not crying as normal. So it's really up to the caregiver, the mothers or the fathers, to notice this changing in behavior in young babies and take them to get checked.
So meningococcal disease or MENSI, which part of Fiji was it discovered first? Did you have cases from any particular regions around Fiji?
So meningococcal disease, as I mentioned, has been here for a long time. So it's not like it was a particular place in Fiji. For this outbreak, the other issue too is that boarding schools tend to be at higher risk of having outbreaks or clusters of meningococcal disease. This is because you have kids living together in a dorm in close proximity to each other. So it's more likely that something is going to spread. So yes, Central Division has seen more cases than other divisions when you're looking at this year. However, we are getting cases from the Western Division, the Northern Division, the Eastern Division. So this is a national outbreak, and that's why we are telling everybody in all the divisions to be aware of this disease.
We'll take another break. When we come back, we'll continue to talk about groups. You mentioned that students in a group, right? Boarding schools, etc. But then there are other places like factory workers, or could be in company. How much risk is there? We're going to talk about this when we come back, Doctor. And meanwhile, if anyone wants to call us and know more about this outbreak and this disease, please do call us on this Talkback Show now. Welcome back on Speak Your Mind with Dr. Aalisha Sahukhan, and we're talking about MENSI or meningococcal disease. So you mentioned earlier that in boarding schools and where there's sexual activities or mouth-to-mouth kissing and saliva exchange, that it's more prone, right? More risky. But not in where people are living in larger groups or enclosed environment. They're not at risk, right?
No. So the people most at risk of catching the disease from someone else who has it are those who live in the immediate household. So your family, if you all live in one house together, then you're more likely to catch it if one of your family members is diagnosed with it. Boarding schools are more at risk because all the children who live in a dorm can be thought of as household contacts, or almost like family members, because you're living in the same house. So that is why boarding schools are more at risk of having a disease like this and also spreading it within.
Doctor, you mentioned that out of the whole population, like you're looking at about 20% people carry that bacteria around the back of the throat or nose area, right? Yeah. And so when they're coughing or when there's saliva contact, which is then people get this disease, MENSI or meningococcal. Now, what about people who have cough infection or may suffer from sinus, etc.? Are they prone to this more than to any other person, maybe, who doesn't have these symptoms and condition?
Well, as I mentioned before, to actually get the disease, the bacteria needs to go into your bloodstream. So ways that this can happen, yes, people who smoke, for example. With smokers, we know that smoking makes your blood vessels a bit more fragile. So it's more likely that the bacteria can go into your bloodstream. People who have frequent infections up in their nose or their mouth, yes, there's a bit of a more risk that they can get the disease. But we're getting into very small populations again. And I do want to emphasize that working in the same office with somebody, working in a factory with somebody, does not put you at higher risk of getting the disease. It is household contacts who are the most at risk of catching this disease from someone who's known to have it.
You mentioned that this is a national outbreak and there's a lot of awareness. How worse can this get if we do not take action now, or we do not adhere to all the awareness and the do's and don'ts that you're trying to create as in awareness? How serious can it get?
Thank you. As I emphasized before, it is still a rare disease. We have about 1 to 2 cases every week now, which is a lot more than we had in the past. The reason we are emphasizing this disease is because it has a high fatality rate. And while there's been a lot of awareness, and our clinicians are very aware and equipped, if you have more cases, there's a chance that there are more deaths. So that would be the effect, is that you'd have more people getting sick, more deaths in the community. And we really just want to avoid it because meningococcal is not a new disease to Fiji, and it's also not a new disease to some of our neighbors like Australia and New Zealand. Australia had a big outbreak in the late 90s and early 2000s. So they saw, in that period of time, in about 3 years, they saw more than a doubling, or about a doubling of their normal rate. So they would have about, I think it was 300 cases a year reported, and that jumped up to 800, 700 cases a year. So they saw that, and then they were watching that for a few years before they decided to take actually national action in the terms of vaccination.
Yeah. So you talked about vaccination. Is that the only way this disease can be treated? Do we have a vaccination?
So vaccination is one of multiple strategies to controlling this disease. And the Ministry of Health, right from the outset, has embarked on working to have all these strategies in place. So there's 4 components that we have decided that are very important for controlling the outbreak. One is early case detection, which means, first of all, making the public aware of what the disease is, what are the signs and symptoms, so that if you have the symptoms or if someone in your family does, you will come and see a doctor straight away. So presenting early to a health facility. The next part of early detection is, of course, making our clinicians very aware of the disease and that we're having an outbreak. So that has been done as well. They're very alert. They are very much clued on to the fact that we're having an outbreak and to have a very high index of suspicion. The next component of control is treatment, making sure that all our health facilities are equipped to treat suspected cases. And this includes having the right antibiotics. Because this particular disease, this meningococcal C type, is resistant to some of the other antibiotics that we used to use for it in the past. So the Ministry of Health has made a concerted effort to push these other antibiotics out to the subdivisions. So, and also making sure that all of our clinicians are well versed in how to treat meningococcal disease.
This includes doctors in public sector, which means the public hospitals and private hospitals?
Yes. So in the last 3 weeks, our National Meningococcal Disease Task Force, which is set up for this outbreak, has been working on revising and putting together guidelines for public health management of this disease. These guidelines were released last week to all clinicians in Fiji, so that they're well versed in the treatment of the disease, and they'll be training in the guidelines that will commence next week and will cover all divisions and include general practitioners as well. And then after treatment, of course, you have the public health response. So when we have a suspected case of meningitis, a meningococcal disease, the public health team in the subdivision or division is notified. And we have outbreak response teams who go out to that person's household and do the investigations. They may give antibiotics to high-risk contacts to prevent spread and to prevent them getting the disease. And then, of course, after that is prevention. So prevention is, of course, the awareness and vaccination. So you see, vaccination is one component of a multi-strategy plan to combat this outbreak.
So do you think that is there a vaccination already in place where if a person or at any point in time, when we were in primary schools, we would get a certain vaccination to prevent us from measles and certain diseases. Is WHO working around that area to have a vaccine so people would not even get this disease?
Okay, so again, emphasizing, because I think sometimes we confuse antibiotics and vaccination, and treatment and prevention. So to treat this disease, if you have this disease, antibiotics are what will treat you. To prevent it is vaccination. So because meningococcal disease was so rare in Fiji before, we're only having 5 to 10 cases a year. We do not have that vaccine on our national immunization schedule. We have vaccines for other organisms that cause meningitis. For example, we have a pneumococcal vaccine. We have other vaccines for other childhood illnesses, like rotavirus for childhood diarrhea. So these are all vaccines that were put in because it was recognized that these diseases are causing a lot of cases and a lot of deaths in children under the age of 5. So there was a lot of investigation and studies that went into deciding on putting these vaccines onto our schedule. Meningococcal disease was very rare, so there was never a need in the past to put it onto a schedule.
Okay, thank you, Doctor, for clarifying this, and we'll be back soon after this break, and we'll ask Doctor more questions. If you have any questions related to Mensi, please do call us on Speak Your Mind. This is Speak Your Mind on Gold FM. I'm your host, Shamilochan Lal, and my guest is Dr. Aalisha Sahukhan, and we're talking about meningococcal disease, or Mensi in short form. Doctor, you mentioned about vaccine, and we talked about antibiotics. Because there is a national outbreak, are health centers in Fiji and hospitals adequately supplied with antibiotics? Is there enough to cater for this?
Yes, so as I mentioned before, this antibiotic that we need to use as the first line treatment for meningococcal, this outbreak, this meningococcal C outbreak, was one that was not available in our subdivisions previously. This is one that is used in the divisional hospitals. Once we did we got results of our lab testing, we found that this meningococcal C is resistant some of the other antibiotics that we're using as the first line treatment in health centers and subdivisional hospitals.
This was at early stages when Fiji discovered that we had Mensi.
Yes, so
this is the beginning of this year.
Yes, so one of our priorities was definitely pushing this antibiotic out to the subdivisions to make sure that if a patient turns up to a subdivisional hospital or health center and there's a suspected case, the doctor there has the antibiotic to give the first dose before transferring to a divisional hospital, because the early treatment of a suspected case of meningococcal disease is life-saving. The earlier that it can be given, the better, and the more chance that the person has of surviving.
And we talked about survival rate too, and mortality rate. So what happens? What are the aftermath of this disease, Mensi? What happens after a person recovers? Is there some repercussions?
So yes, as I mentioned, about 90 to 80% of people who get it will recover. However, 20% of them are likely to have some kind of long-term disability. So this may be issues with their cognition or issues with learning. Deafness is one issue that may come up. There are different sequelae of complications that may happen over a lifetime, but it's a big percentage of all survivors, 20%, who will still have effects, long-lasting effects. So this is why we're really emphasizing the prevention of this disease, as well as the early recognition of the signs and symptoms, and coming to a health facility as soon as you think you may have it, or if your child may have the disease.
What else can we do to protect ourselves?
Well, those basic hygiene methods are really the best thing that the public can do right now to protect yourselves. Washing your hands frequently with soap and water, not sharing glasses or other drinking implements like cups and water bottles, having good cough and sneezing hygiene. These are very important for preventing this disease.
Would you recommend people putting a mask at this stage?
No, it is meningococcal disease is not a disease that is spread. It's not airborne. So things like influenza and the common cold are much more easy to catch than meningococcal disease. You need contact with a person's mouth and saliva and going into your own mouth in order for you to get the disease. So we do not advocate using a mask at all. It will not protect you any better.
Another question, doctor. Why is it happening at this time? Like this is the month of April now. I think it started in January. Is this you mentioned it's not the season, it's not this time, but it happened this time. So if you look at previous years, did it happen at a particular time during the year, or it can happen any time?
Again, it's very hard to tell because our numbers were so low. So it was very hard to tell if there's any kind of season. In countries where it is endemic and they have higher numbers, it's usually during the dry season or during winter period. The reason is that during those dry season, the back of your throat and the back of your nose is drier than normal. So when it's dry, the bacteria pretty much is not happy, and there's more chance that it can go into your bloodstream.
Okay.
So there's a place in Africa, the meningitis belt, which is very well known for having really high numbers of cases, and that's a very dry area. So that's one of the reasons that area is known to be high in incidence for meningococcal disease.
So which means we need not worry, because recently we have had flood, a very wet, rainy season, and it does give birth to some other epidemics, as in people get diarrhea and other flus. We shouldn't be concerned about that at this season.
It's much too early to tell if we're going to have a season, if this is going to be something that becomes endemic to Fiji in high numbers. It has been endemic in the past, but with very low numbers.
Yeah. Should we be concerned or take some precautions now that we've had a lot of flooding and things like that? Is that related to Mensi in any case?
I'm glad you brought that up. It's not really related to meningococcal disease. In a way that it could be is that we have a number of evacuation centers that are open. So there are more people who are living in close proximity to each other under one roof. However, this is very temporary. I've been told that there's big efforts to clear those evacuation centers, and now that the flood waters have receded. But in terms of floods, there are other diseases that are very important as well. In the first week after a flood, once the flood waters go down, we tend to see an increase in cases of diarrhea. And diarrhea for adults may be fine. You may be sick for a few days and you get better. Diarrhea in children and babies is very serious because they are not able to regulate their fluids. So lots of babies and children get very sick, and they can actually pass away from having very severe diarrhea. So this is why during this post-flood time, we are just warning people in those flood areas to boil all drinking water.
Okay. Thanks, Doctor. When we come back from break, we'd like to know what are some other measures Ministry of Health is taking as in creating awareness, and we also prefer to go to restaurants and use utensils. So is that at high risk as well? Soon after this break. Welcome back on Speak Your Mind. We're talking about meningococcal, or the Mensi as in short form, with Dr. Aalisha Sahukhan. Now, doctor, most of us like to go to restaurants and we use these utensils, the silver utensils, we put it in our mouth. Should it be washed in a way, and utensils at home, precautions? Is it a contributing factor to Mensi?
No, because the actual bacteria itself just survives for just a few seconds outside of the human body. It's not something that will survive for a long time on a utensil and get passed on to someone else. This is why we want to emphasize to the public about the risk, the high-risk activities that can actually spread the disease. So it's not those kind of activities where you go to a restaurant, or you go to a juice stand and you're having a glass of juice. No, those activities are not high risk. What is high risk is activities that involve you coming into contact with someone's mouth, either directly or indirectly. So sharing a cup in a social setting, for example, when you are doing taki with beer or alcohol out of the same jug and everyone's using one glass and it's going around a circle. It's not so much that you're sharing, it's that it's going around. You're using that glass and it's collecting saliva and spit, and then that's why. It's not just a one-off sharing of a glass. It's something that's going around in a circle and you're sharing saliva. The same thing with yangona. And if you have a tano that's full of yangona and you're sharing, you have one bilo, there's a chance that you can actually exchange saliva in that situation as well. So those activities are specific ones to Fiji. So in looking at international guidelines, they don't have this, because these are unique.
There are some local things.
Yeah, they're unique to Fiji, and so we had to really think about these when we were putting together our guidelines and our messaging. The other thing that someone pointed out is that we have primary school students sharing lollipops. So that, of course, is a high-risk activity. So it's basic hygiene measures related to, having on glasses and
even parents sometimes they're eating or lollipops or a lolly and then they take it out and put it in their children's mouth.
Exactly. Or sharing bubble gum. Things like this that perhaps in other countries it may not be an issue, but this is our local context and we need to be aware.
Some local habits.
We're very communal. We like to share. So.
So, Doctor, what is the Ministry of Health doing to create awareness to prevent this?
So, from the declaration of the outbreak last week, so that was a big decision to go forward and tell the public so that the public are aware and aware of the disease as well as the things they can do to prevent themselves getting the disease as well as the symptoms so that they can come early to health facility. We've also launched a campaign in radio and TV, which should be starting shortly. Also recognizing that most of the people affected are in the under 19 age group. So thinking about how do our young people socialize these days, and social media is a very big part of that. So we have a Ministry of Health Facebook page that is updated very regularly. Our press releases, which are our weekly press releases, go up there every week. And all of the information about the prevention of this disease and the recognition of the symptoms is all up on our Facebook page, as well as the Ministry of Health website.
Thank you, Doctor, for coming on this show to share a lot of things about meningococcal, or MENSI as in short form. Thank you very much. And I'll see you on Speak Your Mind next week on Tuesday. Thank you.